Hello, everyone, and welcome back to the Practice Perfect podcast. We are so excited to be here. Hello, Maya. How are you today?
I am just fine. It's just been a whirlwind of busyness, but busyness is always great. It's great.
Yes, I mean,
Everything
it
is
beats the
great.
alternative, right? It beats the
Oh
alternative
yeah.
and being bored and twiddling your thumbs, right?
Oh
Oh,
yeah. Oh
my.
yeah. Yes, most definitely.
Well, yeah, we're excited. You guys, you're here at the podcast that talks about compliance, talks about billing, coding, operations, overall just being healthy in our work life. We want to talk about it all. So we're excited to talk today about compliance. I know you kind of like, didn't you guys talk about that last podcast? Like you had a whole podcast about that. Why are you doing it again? Well, because compliance is a never ending drama. It's that aunt that comes to reunions that's always bringing the drama, but it doesn't have to be dramatic if we look at it the right way. And that's what we want to make it. I wouldn't say we don't want to make it fun because nobody likes
It can
policies,
be.
and it could be, yeah. I mean, if you think about the benefits, you'd be like, yeah, let's make this fun, and you can make it fun. You can build a culture of compliance, guys, and that's what we're going to talk about today. So I feel like a lot of people they just think of compliance as oh the rules, the regulations. I'm going to go to jail if I don't do this, and like it's all negative, but like when you know that there is a specific reason you do a certain task, you know that if you don't do this, an actual patient could have a detrimental effect to their health. Of course, your job's on the line, but also, I mean, like that feeling of just integrity that you have, knowing you're doing the right thing all the time. Like that's your conscience,
Yeah.
guys.
Yeah.
That's what that is.
Hmm. And it's really interesting because today we're going to be talking about compliance policies.
Mm-hmm.
And staying on top of the HIPAA regulations, like the billing regulations, and then making sure that the staff is aware of those. And if your staff isn't aware of those through training, proper training, not just throwing somebody to the wolves and then them figuring it out for themselves, that's going to do more harm than good anyway, right? Because if they're not trained, they don't know not to scream their name out in the middle of the waiting room to say, come to the front desk for whatever reason. So I mean, I think in today's episode we're going to do some role play so you can see all of that, but you know, I always like to think of compliance as things that you think about every day, like when you're driving on the road. You got to stop when the sign says stop. You have to you have to do that. If you go to above the speeding limit, that you're out of compliance, so the policeman has a right to give you a ticket. So,
Mm-hmm.
the we got to clear up these misconceptions and think about what we do every day as it relates to compliance, because every day is how we live. Every day we live by rules, and those rules govern the repercussions that happen if you don't.
100%.
So, I would like to talk a little bit actually about this first next segment, why compliance is about culture. I think that's a great segment topic because like we said, when we think of compliance, we think audits, fines, red tape, but it's about the culture. So, a compliance can't thrive and be efficient if people don't get it and they don't want to get it. And I think that's the problem. Is like there's this culture of like, I got to get this done. I don't have time to just look at the rules. I'm going to throw the rule book out the window because I don't have time for this. And that's what it's about. It's when you're stressed out and you have deadlines, it's like the sweat's coming and the just you're feeling heavy, and the last thing you want to do is do the right thing. You just want to get things done and everything goes out the window. It's like you make the worst decisions ever
Hmm.
when
Hmm. Yeah. I was reading this book called The Science of Self-Discipline. It's an audiobook on Audible. And a
Hmm.
lot of times if you don't create an environment of self-discipline, the stress of making bad decisions becomes more evident and inevitable because your mind is not trained to discipline yourself for compliance and making the right decisions when it's needed, when it's most important. Because how many times have you gone to the grocery store and you're hungry and you're like, why did I buy this? I don't even normally buy this. It's your stomach talking. and you don't have any self-discipline, so you buy whatever your stomach is telling you to buy because it looks good. But
Mhm.
self-discipline and compliance kind of go hand in hand, just to gear your mind about what is the right thing to do. And if you don't know the right thing to do, you're going to do the wrong thing.
100%. I mean, I totally agree with that, and I think also that when we think about the nature of compliance, it's never going to go away.
No.
It's not going to be something you can avoid, and so you want to make sure that you start off on the right foot. So we talked about, because these last couple episodes have been really focused on the opening of the office, right? The things that you have to do before you start seeing patients, and I'm just gonna, I'm gonna talk really very bluntly here about how many people, organizations that we talk to that we find do not have a compliance plan. It's a scary world, guys. So, as a patient, if you knew ahead of time that your physician's office is not a compliant organization or did not care about having a compliance plan, they didn't take the time to put policies in place for what if a disaster happens? What are we going to do if a misadventure happens in the OR for the surgery? What's going to happen? Like, if they don't care enough to plan for the future, then why would you want to be going to that physician? They don't care about your health and what could happen to you, because it's life or death in many cases.
Yeah.
In the billing side, not so much, but but I'm like, it's not real life or death there, but it's still serious. But on the clinical side, which is also compliance, you have so many life or death situations. You have to have a policy on what are you going to do if this happens? It's your contingency plan, guys.
It's really interesting, Jennifer. And when people think about compliance, they just think about, like you say, rules and regulations in the office practice, right? But think about wheelchair accessibility. That
Yes.
button that you have to hit so they can come in. What if they didn't happen and the patient got slammed in the face and you didn't have that? That's a compliance issue. And guess what? You have repercussions because the patient can sue you because of that. So, those hydraulic doors, those ramps for the people to get access, you know, um, being able to accommodate for someone who has a different language and you need to
Mm-hmm.
see them in the office, that's compliance. That's a requirement of the law. So when you think about those things and the leadership, and if they say, well, we don't need to do that, we don't care about that, blah, blah. Oh, oh, okay. And
Okay.
then you politely pack your stuff up and say, okay, I'll see you when I see you. I'm just saying.
No, you're right. And I know we're going to have a whole episode on credentialing, but a lot of these things you just hit are actual check boxes and questions that insurance companies ask you when you fill out applications to join their network, to validate just the building accessibility. Do you have one of those phones for, talking to people that can't speak your language to translate? Do you have one of those? All this stuff they ask. I was just filling out one for Centene yesterday for my credentialing client, and it's a long form, and
Hmm.
it's crazy, all the questions they ask. So anyway, that's compliance too, though. I mean, that's all part of it, and we're gonna have so many great episodes, you guys, on the ins and outs of each of these segments. So like, we're starting off, broad, but just know, as we go through this podcast, unlimited potential of what we could talk about and share with you. So please, please, please follow this podcast if you haven't already. Share it with a friend, like it, subscribe, go to practiceperfectpod.com and just follow that website and just engage with us. So, like Maya said earlier, we're going to talk about those compliance program components. So, number one is the policies and procedures. Like, that's the first element of a successful compliance plan, which caveat, I mean, just kind of like disclaimer alert, you have to have if you bill Medicare, Medicaid, according to the Affordable Care Act. Just reminder. Okay. So let's say you bill Medicare, Medicaid, you're going to have a strong compliance plan that doesn't have to be scary or overwhelming, because it's 7 elements and many of them are logical to implement. They make sense, right? Because you want to have policies and procedures. So, Maya, go through a few of the policies and procedures that you think, just to start with, for just to open the doors. Like, what are some of the common ones you just want to have right away as you build your compliance plan?
Well, one, you got to have education and training. You have to have annual audits. You got to provide a culture to report something if they see something. So, those three things, right, are essential to the office, right? And the office culture. If your office cannot, or your staff can't come to you with there's a problem, and there's not a leadership addressing this problem, that's part of, the reporting of when you are not comfortable. You have to have a point of compliance person. Then you have to have training. If there's something that's wrong, you have to have a training. I know larger organizations have computer-based trainings, right? But if you don't have a computer-based training, have someone to send memos, and not a handshake and verbally say it. It needs to be in writing, right? The
Mm-hmm.
policies that come into place. There has to be stakeholders. There has to be a decision maker, right? Even
Mm-hmm.
let's not even talk about third party billing third party billing. They
Uh-huh.
are upholded to compliance as well.
Mm-hmm.
If you don't have those types of things in place, your third party billing company, the office, the things that's related, how you transact, a business association agreement,
Yeah,
those
I mean,
are things that are important. I'm sorry.
when's the last time that you asked your billing company for their compliance plan?
Hmm. Yeah.
Oh, I didn't know I needed one. Well, the
Oh.
OIG says you need one, and they have not changed
Mhm.
in many, many years on that. That
No,
actual policy needs updated like the other one, but it's old, but it's been around for a long time. And most billing companies,
absolutely.
especially offshore, nothing against offshore billing companies, but oftentimes because they're separated from the rules and regulations in a different country, they may not understand the implications of compliance because maybe they don't understand the concept, or maybe it's said differently in their country. Like maybe if you explain to them what this is, they might be like, oh, okay, we have that. But like it's a communication barrier sometimes where maybe they do have one and you just don't know how to ask and they don't understand. There's a language barrier. So
Yeah.
even if you're using offshore billing, make sure that they understand 100% that you have to make sure your patients are taken care of. Your organization is reducing risk by having a compliance plan, and they have to have one too because they're touching patient data, your data, my data. I mean, I have no idea the offices I go to if they're using offshore billing. No idea because I
Right.
don't ask those questions as a patient. But you can bet if I'm a consultant, I'm going to ask that question. I'm going to
And it
ask policy on this.
mhm, mhm. And not only that though, even if they're offshore and they're doing the business on behalf of your office that is stateside, they have to adapt to the business that you're conducting within the states, not
Mhm.
based upon their culture out of state. And so that's why the compliance plan for the billing should be competitive or parallel, I should say, to what the stateside representation of that billing company is. Because a lot of times they think that they can follow their own policies, like you said, Jen, but if they
Mhm.
are not following the stateside regulations and understand what the stateside compliance regulations are, then you're putting yourself more at risk. And that's why when a lot of billing goes awry and there is OIG that's intervening, then you have bigger problems because they didn't know, or it wasn't in the contract, or we weren't told to do that.
Yeah, and we are going to have a whole episode on third party billing. I'm telling you, it's coming because it's on my radar. Because I was having a conversation with another consultant on our advisory team, and we were just talking about charging percentages and things like that. Many people don't know there are actual states in this country who do not. It's actually against the state regulations to charge a percentage as a billing agency. Like you're
Yeah.
not allowed to do it. New York is one of them. New York is flat out
Wow.
like they have a regulation on that. So like if you have a billing company in New York, do you know about the regulations for third party billing? Do you know about regulations in certain states where you can't actually take a percentage of Medicaid payments? There are regulations there. So you
Yeah.
better believe when I own a billing company, I ask those questions. I dug deep.
Yeah. Yeah.
And I
Yeah.
owned my
Yeah.
own billing company several years ago. And now I just refer out to people who want to take on that mess. So it's not for me anymore. But anyway, like that is important. So have a policy on that. And then, of course, getting into element number 2, have a compliance officer, obviously somebody designated that is going to basically be aware of the moving pieces and be in charge of making sure it happens. It's not just that person's responsibility, as we talked about in the last podcast, on the compliance podcast, but it's about making sure that you know what's going on and you go to the people that need to make those decisions and let them know what is the risk of not handling this sooner than later.
Mm-hmm.
And then, of course, yeah, you want to have the education and training, like Maya mentioned. You have to have a policy on it, first of all, for element number 1. And then you also need to actually have regular training. Then you need to also make sure you have a way for them to communicate. So they say they have that training, right? They know what's expected of them. They see Joe Smith over here doing something really shady with the billing. And they're like, I remember our training, and that was not what we're supposed to do. And then they're like, should I say something? The minute you ask yourself that question, you have
That's
a
when you
problem.
need to. Yep. Yep. Yeah, I mean, and also, I mean, and I want to bring this forth too. Whenever there is a compliance officer that is designated for the office, make sure they know what to do when there is a problem. Don't just
Oh,
let
yeah.
them sit there, and you tell them the issue and then they don't do anything.
Yeah.
Excuse me. Yeah, I mean, because I think it's important when you're dealing with compliance that they know that when they're told something that's not right, that they do something when it's not right. Telling somebody, okay, well, let me work this out, or let me tell Dr. So and so, or don't just tell somebody and they don't do anything about it. Then what's the point of them being a compliance officer?
Exactly.
I'm just saying.
Absolutely. So yeah, you had the training. You're going to go ahead and make a way for them to communicate with, securely, report any, anonymous situations. They can come to you in person if they want to, but there also should be an anonymous way to report violations so they can be investigated. And then you want to actually investigate them. Compliance officers and office managers and administrators, please investigate them. Don't be part of the problem. Don't be the one that cares so much about the money and getting the money in and out that you try to get it a non-compliant way. Try to
Mm-hmm.
be the person they can come to and they know you're going to do the right thing because you're an ethical person. Be that person, please. We need more of you out there.
Absolutely.
And absolutely, yeah. And so then have the auditing and monitoring in place. So again, you not only should have internal audits, but also what, Maya?
External audits. Hello.
Hello, we're here. We are your auditors. We love
Yeah.
to come in and audit your stuff because we don't know you and we are not best buds with your doctors. And
Yeah.
we're going to look with fresh eyes, fresh
Yes.
eyes, and we're going to be able to see exactly what's going on. Fresh eyes, guys.
Yes. And you know what? And what's also interesting about outside audits is the recommendations that the auditor must provide when there is an outside audit. Don't just, oh, this is interesting. Thanks.
Okay.
No, if we're recommending that, then it's something that you need to address because it could be a potential problem. The last thing you want is for an auditor to tell you what you need to do, you don't listen, and then you get audited by the RAC or you get audited by UPIC, or one of those, or CERT, and
Mm-hmm.
it's part of their recommendations or one of your deficiencies, and it was part of your recommendations and you didn't pay attention. That's just like
Yeah,
shooting yourself in the foot because now you're losing revenue because you didn't listen.
exactly. So I mean, it's all part of it, guys. We want to make sure that we're understanding this culture that we're building. And so there's the good and the bad and the ugly. And so we're going to kind of show you what that might look like. And sometimes, yes, you have to talk to the compliance officer as a supervisor. So we picked this little scenario. I mean, there's lots of compliance role play we could have done, but I thought it'd be fun to just play on this relationship because this is the relationship that can make or break the compliance structure. Is when the compliance officer may have something to say to the practice manager or the administrator, and it doesn't quite go well. And we want to kind of talk about how that might work if there's resistance to something, right? So I'm going to be the compliance officer, and Maya is going to be the practice manager. So we're gonna have a little conversation here.
Okay.
Okay, so Maya, we need to talk about this
Oh,
new documentation process. I have noticed staff members are not following it properly, and this is creating compliance risk for us.
I know, Jennifer. I've been hearing complaints from everyone and how this process is slowing them down. They're frustrated, and honestly, I don't blame them.
Now that's a real conversation that could happen. But in Maya's response, there was something very unique that I picked up is that she understood. She'd heard the complaints. But what did it prevent her from doing? Like, where did it stop, Maya? Where did that stop when she heard the complaints?
I mean, to me, she heard the complaints and she says that she doesn't blame them, but she didn't respond to say that she was going to do something about it. And that's the issue, like we just mentioned. If you have a compliance officer that's coming to them and you're addressing an issue, there has to be action for the issue. There has to be action. If there is no action, then you just might as well continue to have a conversation because nothing's going to happen.
Exactly. So I think that this is something that we can maybe do better on. So let's just try a little bit, dig a little deeper, and let's just try to have some conversation here.
Okay.
So Maya, I want to touch base with you about the new documentation requirement. I've noticed that some staff members are struggling to follow the process, and I wanted to see how we can make it easier for them.
Okay. So when we're dealing with, hold on, wait a minute. Okay. Now let's shift gears and address some compliance issues about compliance myths, Jennifer. I read the myths and you tell us the facts. Wait a minute.
Yeah, I'm sorry, Maya. I think we have a problem with our role play script. It's my bad.
Okay.
So I'm going to ask you again. You're going to have to ad lib, girl. It was my fault. I messed your script up. It's live. I don't care. We're live. We're just gonna, I'm gonna tell on myself. I messed up with the script. I gave Maya bad information. Here I am giving her bad information. So Maya, I'm gonna ask you again, and you just
okay.
do your thing. What would you say if you were the opposite? Okay, here we go. Hi, Maya. I wanted to touch base with you about the new documentation requirement. I have noticed that some staff members, they're struggling to follow the process. And I want to see how we can make it easier for them. What do you think?
Well, I think we need to take a look at a couple of things. What type of things are you seeing? I mean, are the staff just ignoring them? What's happening?
That's a great start because you're invested, you're engaged, you want to know. And maybe it's a situation where you've been so busy and you haven't really, maybe no one has come to you. And you're like, why isn't no one coming to me? Why is the compliance officer knowing about these things, but I'm not? So there you're like, I want to know. And that's the attitude to have. And so I think that's a good start with the process of going forward. I mean, Maya, what else would you like the office manager to do next? Like, what should their next step be?
Okay, I would say let's have a meeting. Let's discuss it in the open to find out what type of issues are coming into play. And so I can make note of them all and address them accordingly.
Exactly. Now, I did prepare today to actually read off some common myths that we see. So there are compliance myths versus facts. Now, one of the biggest compliance myths that I see out there, and I'm going to see if you have any as well, Maya, is compliance is just for the billing and coding teams. I get that all the time. I don't know where it comes from. I just don't know.
Yeah, I think it's just, they think it's all about payment. And really, compliance is about everything. When you drive, is it only when you're on the expressway, or when you drive, is it when you get behind the wheel?
Right, exactly. I mean, I would say it's more so when you're behind the wheel.
I'm just saying.
I mean, a lot more can happen when you're behind that wheel. I'm telling you what. Like, I don't know. Like, there's also the myth that compliance is just HIPAA. I'm just like, what? I mean,
with 1 P or 2 Ps, there's no PP in HIPAA.
That's true. There's a double A. Oh my goodness. Yes. Okay. I mean, like another one here. Copies of medical records can only be provided to a patient or the patient's caregiver. Now that that's part of HIPAA, but like that's something that people misconstrue a lot too on who can receive medical records, and they're always just so stressed out about the process. But reading through the guidelines and actually the Privacy Act and all of that, you can see the different people that can get copies of the patient's medical records and who do get copies. But the compliance comes into play where you understand how to release those records compliantly or legally.
Right. And the patient has to consent to whatever it is that you're releasing to another entity. That's when you look at the HIPAA or the CMS 1500, there's a line. I authorize this office to release medical or private health information on my behalf in regards to payment. So that's something that needs to be signed. But once it's created, that gives the patient that the patient is authorizing for that to be released. So that's a big
Mm-hmm.
thing too. Yeah.
Yeah. Oh, here's one, Maya. We're a small organization. There's no way we can be expected to do all of this. What do you say to that?
Well, the OIG says specifically that the compliance rules and regulations don't have to be a cookie cutter. They have to be based upon the ability and the size of the office.
Exactly. So you're a one physician practice. Tailor your compliance plan for your small organization. You're not going to need all these fancy whistleblowing, excuse me, fancy. That's not what I meant to say. We don't need all these fancy, pretty policies that are so extensive. We need to actually understand that for a small practice, you're looking at, you don't have an OR attached to your facility. So you don't have that kind of compliance. It's, yes, the code of conduct. It's what you're going to do if a disaster happens. It's what you're going to do if this contingency needs to be taken care of or this thing happens. So make sure you have a policy on things that actually would happen in your organization, not something that would happen in the practice next door that has like 10 physicians.
Right. Yeah, I
Not the
mean, I
same
think
thing.
and like you said before, compliance is being rational, right? If you get up in the morning, you're going to take a shower. That was the rule. You get up and you take a shower. You brush your teeth. Those were the rules in your mother's house, like Christine talks about, right?
Oh, yeah.
When you get behind the wheel, when you turn right, there's a turning signal. When you turn left, there's a turning signal to let everybody else know. So compliance is not just about the office, it's for your patients. It's for everybody who comes in and out of the office, whether they work there or not. But it's for everybody, and the rule should be applied for such.
Okay. So one last myth, Maya. My EHR takes care of it for me.
Oh, brother. The EHR is not a one stop shop. The EHR is end user driven. So, whatever you put into it, that's what they're going to do. If your EHR is not designed to be compliant, then you have a bigger issue because you didn't ask for it when you bought it. Hello.
Mm-hmm. And that's part, remember we talked about last time, our software, you got to ask those questions. That's a big question. We actually do offer a service to help vendors on their side if they want to make sure that they have all of their boxes checked. So when they talk to a physician practice, they know how to respond to those questions, because a lot of them,
Absolutely.
unfortunately, don't know how to respond. I've been on the other side of those calls with a medical practice and I'm asking specific questions. I'm telling you, that software person, that vendor or that rep does not know how to answer my questions. They're like looking like they're sweating because they do not know how to answer that because they weren't trained to know to answer it.
And that's one thing that I cannot stand is for someone to sell me something and they don't know the product.
Mm-hmm.
That's one sure way to get me to turn the other direction.
Oh,
You
yes,
gotta know your product. And on the other hand, when you're interviewing for new systems, EHR optimization, that type of thing, have your stakeholders involved. Don't just tell them that this is what you're doing. Tell them what that system needs so that they can make a consensus, a conversation about when they talk to the vendor, especially if they are able to answer the question. If they aren't answer the question, I would just throw them out. I wouldn't even involve them.
Yeah, it's just it's not going to lead into good conversation. So know your compliance plan, know why you are going to build a compliance plan that's effective, and do it for you, do it for your patients. Don't worry about what the person next door is doing or not doing. You do you, because you know the right thing to do and you're going to protect your organization. So 5 ways to build a compliance culture. Number one, lead by example. Your leadership needs to prioritize compliance, and your team will follow you as a leader if you are showing that example. Number two, Maya talked about, provide regular training. And Maya, does it have to be like hour-long sessions to provide
No,
training?
absolutely not. To be quite honest with you, the average person only listens to somebody for 20 minutes attentively. So if you do it short and sweet, they're going to more likely remember everything that you talk about rather than that hour that you're making them sit. Because after 10 minutes, they're scrolling at their phone, they're looking at everything. So, I think it's important that we all address that and be mindful of the person's attention span.
Yeah, and make it engaging, because if it ends up going on for an hour, you may have only planned 20 minutes, but you're actually getting real feedback because there's interaction between the teams, and you, before you know it, you're spending an hour, but it's not dead space of just like straight education. It's interaction and questions, and it's lively, and that's what we want to see. Um,
Absolutely.
Number three, celebrate wins. Acknowledge when they get it right. That's so important. And we don't see it enough. We don't see that, here's a cookie, you did a good job. Like, we don't
Yeah.
see enough of that.
No, no. I mean, especially with the front desk, right? If they, I mean, and we talked about this, the front desk to me is the hub of everything because they represent everything. If you celebrate the
Mhm.
front desk, they will be, I'm telling you, they will be the gauge, the draw, the magnet for the patients returning and for good
Mhm.
referrals and business.
You can see it on their faces. They light up and they're just so happy to see everybody because they love their job. And that's what we want to see. And then number four, create open communication. So encourage them to tell you when something's wrong. And if you've done something wrong and they tell you, be humble and accept it. We're all human. Even if we're a supervisor, we're not perfect. We're going to make mistakes. We have a lot of decisions to make, and we're not always going to make the right ones. But when we listen to our team and allow them to communicate with us, it can encourage us to do better. And then we can also encourage them by our example, going back to number one as a supervisor. So it filters together there. Number five, make resources available and accessible. This is my biggest, this probably is number one for me, but like, this is so huge. Um, People don't have the resources they need. They would be so efficient and just so happy with their jobs if they got the resources that they needed to do their jobs.
And there's one unspoken thing of these five things to build compliance. You know what that is, Jen?
What is that?
Accountability.
Oh, yes, ma'am.
Be accountable for what you teach and be accountable for what you do.
Mm-hmm.
I'm just saying.
Absolutely. And
Hmm.
that is the name of the game, guys. It's accountability. It's making sure you know that what you're responsible for at the end of the day. It's part of that. So I'm really excited for all these future episodes we're going to have. I want to thank everyone for joining the podcast today. We had such a great time. Wasn't it fun talking about compliance today? I had fun.
I know I always have fun talking to the one and only Jennifer McNamara. I
And yeah.
just I just love my friend and I love talking about things that we have compassion about, very passionate about. So,
I mean, we try to show it our faces and the way we talk to each other and interact with each other. We really do care about
yeah.
all of our listeners, all of the medical practices out there that are trying to survive, because we need you. And I tell my physicians all the time that I'm consulting with, I was like, we're here to help because we need you and your patients need you. And we know the pressure is real. We know that it's real. And it's getting really difficult with all the regulations changing all the time, and it can be difficult to keep your doors open. And so that's what we're here for. We care about creating a space for you that can be efficient and help you grow. So again, thanks for listening. Make sure to subscribe, leave us reviews, and share the podcast with all your friends. And tell us your biggest compliance challenges when you review us and ask us questions. Your question might end up on a future show. So until next time, let's try to keep going and get as close to perfect as possible.